Hello, Dr. Panchwagh.
Hi.
So you've been successfully running this brain tumor treatment center and a very useful YouTube channel for patients,
Correct.
which is called the Dr. Jaydev Panchwagh channel, on which you have a playlist which is called Defeating Difficult Brain Tumors. I was wondering why you decided to have an entire playlist dedicated to this, and do you have any background for developing this?
See, brain tumor as a diagnosis is a very devastating diagnosis. So, if a person is given this diagnosis, then he becomes shattered, he or she becomes shattered. And in the Western countries, there are ways to support them through this phase in the form of patient support groups. Now, patient support groups are the groups of people who have undergone treatment, either surgery or more than surgery, for these brain tumors, and who have successfully overcome these brain tumors. These people talk with the people who have been freshly diagnosed. So the new patients get that strength of their mind through those stories. So they are extremely powerful stories. And if you go back in human history, humans have always told stories and given messages through stories. So patient stories are very powerful as patient support kind of a mechanism.
And to reassure them as well.
And to reassure them. So we decided to create such videos about patients who had difficult brain tumors, So in Pune, we are focused at our brain tumor center to operate on these brain tumors and give back the life that they had before. So we decided that we should include some of these stories. And that's why we started this, and people have really appreciated this. Somebody telling that I had this tumor and I was operated and I got cured and now I am leading normal life, then it gives a lot of assurance to the patient who is now suffering from the brain or newly diagnosed with brain tumors.
Because not all brain tumors are cancerous.
Absolutely.
Many of them are non-cancerous, and it's very much possible to get back your original life.
Correct.
But a diagnosis of brain tumor can be devastating and very shocking for the patient and the family.
Yeah, you're right. Actually, few months back, we had a case, and I can even show you that case, the MRI of that case. Anyone who is not a doctor can also see a big brain tumor. Okay, this lady was suffering from weakness in her right leg for a long time, and she was investigated by various doctors for spinal problem. But actually the cause of her weakness was a large brain tumor growing on the left side of her brain. It was really a huge tumor. If you see this MRI here, you will very easily see this rounded large white shadow. Can you see this?
Yes.
So this rounded shadow is meningioma. It's a benign tumor. It has grown slowly and it is compressing on important parts of the brain, especially the parts of the brain which are responsible for controlling power on her right side of her body.
Oh, so the left side of the brain controls the power on the right
on the
side
right
of the
side.
body.
So she started getting weakness in her right lower limb. Recently, that is few months back, she realized she is also suffering from weakness in the right hand. So it became apparent that the entire right side is becoming weak, and somebody thought of doing MRI, and this huge tumor was diagnosed.
Oh, so now I understood what you meant. So she had leg weakness, so the local doctor actually got her spine MRI done. But eventually when the hand also started becoming weak,
Yes.
that is when somebody decided it's possibly, more relevant to get the MRI. Oh, I see.
Yes, so that is another aspect of our brain tumor center, to educate public about early symptoms of brain tumor. But coming back to our subject, when this diagnosis was given to her, she was shattered and she became so afraid that she decided not to get operated, not to get treated at all. Till she saw one of our videos And then she was convinced in her mind that if this person can get cured, then perhaps I can also get cured. And then she came to our brain tumor center and we operated on her. It was definitely a difficult tumor to operate on, but we could remove it completely. In this slide, you can see this large brain tumor on the left side, and on the right side, you can see that the brain tumor is completely gone. There is no
Really?
brain tumor here.
This is so fantastic.
So this is the power of modern neurosurgery. And this is what we have to tell people so that they are not afraid and they take proper decisions. So we operated on her, and within a month she regained her power. She started walking normally, and this is her photo with her husband when she had come, I think 8 months after her surgery.
Oh,
And
this is so sweet.
yeah, and she is very happily standing by the side of her husband, and now she tells us that she is working full time and she has no deficits. So a person who was diagnosed with a huge brain tumor is now leading a normal life.
Certainly, while the diagnosis of a brain tumor can pose a lot of emotional challenges to the patient, as a surgeon, you also may have faced some challenge while operating on a tumor which is this large and which is, near very critical areas of the brain. Could you elaborate a little bit on what challenges you
Yeah, so needless to say, this brain tumor had definite operative challenges. Important structures were next to the tumor. The tumor was stuck to the area of the brain which controls not only the power on the opposite, that is right side, but also being on the left side, it is pressing on the area which controls our speech. So this was in a very, very eloquent area. So our job was to remove the tumor completely, but not to touch the brain as far as possible. So this is the challenge in brain tumor surgery.
What kind of modern neurosurgical equipment actually help you in achieving the result that you want in a challenging tumor like this?
The technology has advanced quite rapidly, and now we have equipments like most modern neuromicroscope, which has got excellent magnification and illumination together. So it can give excellent illumination and clarity in the depths. That is very important, and which was not available to neurosurgeons in last century. We have neuroendoscopes which can go in small crevices and cavities of the brain, so we can see the structures around the brain tumor and we can save these important structures. So I will show you endoscopic image here, and this is the image through which you see in the depth or crevices of the brain.
Wow.
And so neuroendoscope, neuromicroscope, then we have equipment called as QSA. It is a ultrasonic aspirator, and what it does is it vibrates the structure of the tumor, and it separates the individual cells of the tumor without pulling it. One of the problems in brain tumor surgery is that when you pull the tumor to remove it, the pull is transmitted to the structure which is next to the tumor, so that can get damaged. So this QSA is able to separate the tumor cells without pulling it, just by vibrating and then removing the cells, so the remaining structures are not harmed. Similarly, the blood vessels are not cut by the QSA, so the blood vessels remain intact, and sometimes
So the blood loss is also less,
blood loss
possibly?
is less. We can have control over the blood vessels. So this is QSA. The fourth notable thing is what is called as neuro-navigation. So neuro-navigation is the computer assisted, or now AI assisted machine, which guides us through the brain to reach the exact spot without disturbing the surrounding structures of the brain unnecessarily. So this is the power of modern AI.
But I would also imagine that all these extremely state-of-the-art and modern equipment that you use is also helpful for the entire team who's assisting you in the operation. You certainly have the best of views, but the others are also better able to assist you because they can also see just as well as you do.
Yes. So microscope, when we use modern neuro microscope, there are the picture can be seen on big screen by everyone, and it is useful for the students as well as sisters or brothers who are assisting us in the surgery,
And the anesthesiologist.
and the anesthesiologist also. So, I spoke about CUSA and the navigation. Then there is intraoperative monitoring, which can tell us about which area of the brain is important and which area of the brain is relatively less important, so that we can avoid important brain structures and then attack the pathology directly. So this is neuromonitoring. Even the diagnostic machines like MRI, they are of better quality. They can diagnose tumors early. They can also show us the structures around the tumor before we operate on the tumor. They help us in planning. So usually whenever we operate on brain tumors, we plan beforehand about the approach, which areas will come in the way and how to avoid them, and what will be our strategy. So it's like, a mini war. Make a strategy and then follow that strategy.
But there are so many kinds of MRI machines available. So how would you suggest which one would be a better MRI?
So MRI machines are of different strength, and that strength is calculated in Tesla. And the Tesla value of MRI tells us about its ability to show the smallest structures with clarity. Presently, we have for our routine use 3 Tesla machines available. 7 Tesla machines have come and they are predominantly being used outside India for research purposes. But eventually, they might come in diagnostic field. But presently, we have 3 Tesla MRIs which are available. Also, the software programs in the MRI can show us different things. For example, functional MRI can show us which is the area around the tumor which is important. Putting it simply, we can chart those areas on MRI. So that's how MRI is extremely useful. The modern MRI is extremely useful in treating the tumors. As I was saying, there are certain kind of brain tumors which can be removed completely through endoscope, like the third ventricular colloid cyst, or the tumors located at what we call as foramen of Monro, in the depth of the tumor, the center of the brain.
Deep inside
the brain, almost at the center of the brain. If you consider the skull as a sphere, these tumors are located at the center of the sphere. So in selected tumors, we can put a small endoscope of the size of a fountain pen, and this endoscope reaches to the tumor, and we can operate there through the endoscope by making a very small opening in the bone, 1 centimeter opening, and remove the tumor. Of course, all the tumors cannot be removed. In fact, there are very specific tumors which can be removed. So it should not be taken in a wrong way. But now technology is going in that direction, where it is taking us.
So a keyhole surgery can be performed for brain tumor, but it may not be correctly indicated for every patient.
So every brain tumor needs different type of approach. So some brain tumors can be treated with this, and people should be aware about this, because we operate a lot of third ventricular colloid cysts, because we are the center, one of the centers which operate this through endoscope. So literally we make a small opening of 1 centimeter, we go in, remove the tumor, and the patient goes home the next day.
Yes, so is it safe to conclude that the MRI to be done prior to the surgery has to be of very good quality and of different, as the surgeon indicates? Maybe a spectroscopy is needed, or a functional MRI is needed, so that it aids in the correct and successful removal of.
Definitely. So the brain MRI that is ordered for brain tumor, first either on CT scan or routine MRI, tumor is diagnosed. When these patients come to us at the brain tumor center, sometimes we get the MRI repeated, because we want specific things to be seen in the MRI, and which eloquent areas are around the tumor, whether there are blood vessels around the tumor, etc. So in such situations, we repeat the MRI. And especially if the tumors are located deep, it is all the more important. For example, I'll show you this slide, and you can see that there is a tumor here, I will outline it for you. So this is the tumor seen in sagittal section. If I show the same tumor in coronal section, you see this rounded big shadow, and also you can see these black shadows inside the tumor. These are important blood vessels. So this is a very, very critically located brain tumor. Again, it was a meningioma. And this person, when she came to us, had lost vision in her one eye. And she didn't realize that it was because of the tumor till the MRI was done. And then we removed the tumor completely. You can see this MRI after tumor removal. This is the same area of the tumor that you see here. And on the left hand side, you see the tumor, the white tumor. On the right hand side, you see that that area is completely empty. So the tumor is totally removed. This patient didn't regain the vision which she had lost because tumor had destroyed that optic nerve, but we could save the vision in the normal eye. Otherwise, this tumor would have made her completely blind and eventually would have caused danger to her life. It was a difficult tumor. There were important blood vessels inside the tumor. It was involving pituitary stalk and hypothalamus. All these are important brain structures. But because of navigation, because of excellent neuroendoscopes and microscopes, and because of excellent radiofrequency wave machines which can deliver energy at the depth of the tumor, we could remove this completely. And this is how we present the cases, you know. These two are the examples of the cases which we would put in front of people who are newly diagnosed to show them that these people were cured and they are leading normal life.
Both of them had meningiomas, both were not cancerous, both of them were removed completely. One lady who had lost the power in one of her hands and legs got back her entire power within a month of surgery. One lady who was losing vision, at least the eye which was normal, that was protected from further loss. So these are wonderful stories.
So in fact, we have innumerable such stories at our brain tumor center. Till now, we have operated in the last 20 years more than 5,000 brain tumors of different varieties. Some of them were benign, some of them were not benign. But to remove them with modern technology has been our aim. And especially in the last 5 years, we are seeing better and better results because of technology advancements.
I think one of the another advancement is radiotherapy. So it is also possible to safely remove a tumor if it is attached to very critical areas. So
yeah, focus radiation therapy is now available at many places. And if part of the tumor, maybe last 2 to 5%, is adherent to a very important structure like a cranial nerve, we can leave it behind. Afterwards, we can observe it or radiate it with a focus radiation. And focus radiation is very safe because it is delivered only to that portion. But it can be delivered to only small tumors. It cannot be delivered to large tumors. So yeah, there are such technologies which is aiding brain tumor surgery to completely cure them and reduce the side effects of surgery. So all in all, I would conclude with the sentence that people have to understand the brain tumors properly. We have put a lot of videos about brain tumors. Please see them. We have put videos about early symptoms of brain tumor so that people should understand. They should not get afraid and be aware that modern technology has changed the game completely. And in most of the tumors, people can get back to their normal life.
Thank you. Thank you very much
for
shedding light on this topic.